In the case of the current COVID-19 pandemic, we have not had any positive cats or dogs, and so it is believed that they do not get infected with this virus. However, if they are living with a sick caregiver, they may act as a fomite, which is an object where the virus may sit and be transmitted to another person. Just by definition, the fact that this is a pandemic means that the virus has reached global infection. And so people globally are infected, and what we have seen in other countries is what we call morbidity, which is the illness itself, and mortality or death rate isn't necessarily extremely high. However, because this is a new virus, the amount of people getting sick at the same time can overwhelm healthcare systems, which is a really big concern to taking care of the people who are ill. All of the current recommendations for social distancing are really in an effort to slow the spread. Unfortunately, the reality is many of us are going to get exposed and likely infected with this virus, but if we can slow the spread so that it doesn't happen so quickly that people are ending up needing and using up all of our healthcare resources all at once, we can better fight the disease. At PAW Health, we want to take every step and effort that we can to minimize exposure of the virus to caregivers, minimize exposure of our employees, and still be there to take care of your patients. And we will be. There is no plan to reduce or discontinue any services, so we will be available for your ill pet's needs. But what does that mean when you come into the clinic? A few things. The first thing is we are going to ask that you get a pen and you keep a pen. We are going to minimize sharing as much as possible. We are limiting the number of people that will be allowed to wait in the waiting room at a time. So that may mean you are asked to wait in your car while your pet is evaluated, and then come in for a consultation with the doctor. Additionally, we will not have some of the shared use amenities like coffee and tea and hot chocolate that we typically have as a way to reduce exposure. At PAW, we are already very strict in our cleaning habits as just a way to keep the clinic clean and minimize any sort of infectious pathogens. We are going to be taking extra efforts to minimize potential exposure to the coronavirus. And by that, we will be cleaning services after caregivers touch them each time. We will be eliminating the use of clipboards and instead using our hard surfaces that can be cleaned easily with each individual caregiver. At checkout, we will be cleaning any of our surfaces with each individual process, and then in general, our waiting room and all of our consultation rooms will be cleaned between caregivers, and then generally all touch surfaces hourly. Additionally, when you bring your patient to PAW, if you have them wrapped in a blanket or carried in other linens, we are going to ask that you remove those personal items, and we will have clean clinic towels available to place your patient in for movement into our treatment area. Again, this is to minimize the movement of fomites to additional spaces within the clinic. Also, when you come into the clinic, please know that we have asked any ill staff to simply stay home. We have also implemented guidelines that ask them, if they are not feeling well, to utilize the COVID hotlines to seek guidance on if they need to self-quarantine or be seen by their primary care provider. Also, with our well staff, we are going to be asking them to increase their availability of hours to help with our additional cleaning efforts so that we can continue to see your patients in the most effective and efficient way possible. At PAW, our core mission is to serve the patient. If your pet needs care, we want to see your pet. However, if you are ill, the best option is to find a healthy or well friend, family member, someone you trust who can bring your patient in and act as the acting agent and where you are available by phone. If that is not possible, please call the clinic prior to coming into the clinic so that we can take additional measures to ensure we are minimizing everyone's risk and exposure to the virus. As veterinarians, we took an oath to protect public and animal health. At PAW, we show up every day to serve the patient, and by taking these additional precautions, we are hoping to minimize any infectious risk to caregivers, you, the public, while maintaining the best service and care we can for your patients.